A generative algorithm designing a personalized gene therapy looks nothing like a canvas medical tent pitched in a muddy 18th century field. In the book, The Medical Superpower of America, Prof. Dr. Milton Biswas chronicles a 250-year story of survival, arguing that America's medical supremacy emerged directly from repeated moments of national catastrophe. In 1776, early American healthcare was a fragile, scattered system. Practitioners relied on a mixture of rudimentary European practices and invaluable indigenous botanical wisdom, treating ailments with native plants like willow bark and echinacea. How did a fledgling nation bridge the massive gap between battlefield amputations and AI-driven precision medicine? Prof. Dr. Milton Biswas demonstrates that the history of American medicine is a story of human resilience, where the primary engine of progress was the pressure of national crisis. During the Revolutionary War, the Continental Army faced decimation by disease. George Washington mandated mass smallpox inoculations for his troops, creating an early framework for military public health. Less than a century later, the Civil War forced a complete overhaul of trauma care, driven entirely by the massive scale of battlefield casualties. The necessity of moving wounded soldiers rapidly under enemy fire drove the implementation of the first organized ambulance systems. Accommodating thousands of patients required vast, structured hospital wards designed specifically to isolate infections and manage continuous care. To handle massive trauma from artillery fire, practitioners rapidly adopted battlefield anesthesia and standardized emergency surgical techniques. Managing all of these distinct cases forced the military to develop systematic medical record-keeping to track treatments and monitor survival rates. The logistical chaos of combat forced the implementation of triage, records, and rapid evacuation. This exact blueprint still governs modern trauma centers today. As the country industrialized, dense urban centers bred new threats. Outbreaks of cholera, tuberculosis, and polio ravaged civilian populations. This photograph captures the visceral reality of those epidemics, showing the sheer scale of the medical response required just to keep patients breathing. Managing these recurring public health crises required a more disciplined workforce. Nursing became a formalized profession, and rigorous medical education became the standard. The acceptance of germ theory, debated and disseminated through newly established medical journals, shifted American medicine away from folklore and toward evidence-based science. Combating these industrial-era epidemics successfully institutionalized the practice. Disparate practitioners were organized into a unified infrastructure of regulated schools, standardized hospitals, and peer-reviewed research. The global conflicts of the 20th century accelerated technological innovation, translating wartime urgency into a permanent peacetime biomedical ecosystem. The mass production of antibiotics during World War II proved that infectious diseases could be controlled on a global scale. Supplying troops overseas demanded the logistical mastery to establish massive blood banks and standardized transfusion protocols. This wartime technological momentum sparked a rapid leap in medical imaging, starting with early diagnostic X-rays. This diagram illustrates how imaging technology evolved to render internal structures visible through three-dimensional MRI and CT scanning. The same quest for internal precision moved from organs to the molecular scale of the cell. Leveraging advances in microscopy and recombinant DNA, researchers began decoding the genetic instructions that govern those systems, culminating in the Human Genome Project. Wartime logistics, combined with massive post-war scientific investment, positioned the United States as a leading biomedical innovation hub. Today, Prof. Dr. Milton Biswas points to a modern reality check, the concept of the American healthcare paradox. We see the pinnacle of medical innovation in spaces like this, featuring AI-assisted diagnostics and precision robotic surgery. Yet this high-tech reality coexists with fragmented insurance systems, exorbitant out-of-pocket costs, and severe health inequalities that isolate rural and marginalized communities. A nation producing advanced medical breakthroughs still struggles to provide equitable, affordable care to its own citizens. Innovation has drastically outpaced access. Looking ahead, digital twins allow doctors to simulate treatments on a virtual patient before ever making an incision, moving the field toward hyper-personalized, predictive care. As Professor Dr. Milton Biswas concludes, maintaining medical leadership in the age of AI requires balancing this technological brilliance with profound ethical responsibility. The 250-year American medical journey is an ongoing project. Future success will be measured by a commitment to making life-saving innovations accessible to everyone.